Marianne, thank you so much for joining us. April 23rd and 24th, again, for those pre-registration dates at the Rankin Construction site on Martindale Road, and visit rankincancerrun.com for information. Niagara Health is welcoming visitors at the region's hospitals, and we welcome Dr. Johan Viljoen to The Source. Doctor, you're also launching virtual urgent care this month. What is that exactly?
Wow, that is one of the really positive messages we can share with the community as we go into the spring. So Niagara residents who require urgent care now have the choice. If they cannot access their own primary care providers, which is still the number one choice, they can book an appointment online to see a Niagara Health provider, from the comfort of their home. So our virtual urgent care service does provide a new healthcare option to the region of Niagara. During such a virtual visit, the healthcare providers will assess the patient's condition, and then they'll recommend a course of action to them. So it may still be that after a chat, such a resident may be directed to an urgent care center or an emergency department, but certainly it adds to the services we can offer to Niagarans.
What time of day is that available to people in Niagara?
That will be available during the week, during normal office operating hours. Certainly the details are all available on our website. So always good to check there as to how that will work.
Visitor rules at Niagara Health facilities now are opening up a little bit as well?
Yes, so we are welcoming more visitors to come and see their loved ones in the hospital. So we are welcoming 2 visitors at the bedside now at any one given time, and that includes all the units, including our moms who are in labor and the little ones who are in the NICU. And there's no restriction on how many visitors can come through the course of a day, just as long as that's 2 at the bedside at a time, between our normal visiting hours of 11 a.m. and 8 p.m. Very importantly as well, in our outpatient areas, in the ambulatory care areas, and in the emergency department, and in the urgent cares, we certainly encourage that patients can now bring a support person along to help them with communication. The essential care partner program continues to function as well for patients who have to stay in the hospital for 7 days or longer.
Surgeries that are non-urgent, are we resuming some of them as we speak?
We absolutely are. So we are building up our capacity quite well at the moment. Because there is bed capacity in the hospital, we can do more inpatient surgeries. We are also, ramping up our surgeries that we can do as day surgery. So we're looking at cataracts. The inpatients, we're primarily looking at joint replacements, so that we can work away diligently at the backlogs that have been created. So yes, we're well on our way to deal with wait lists at this time.
Some business as usual at Niagara Health. Dr. Viljoen, always a pleasure to see you. Thanks for your time.